Hello and welcome back. So in the previous video we discussed how you can choose one of the protocols that already present in the software to transfer them into your patient file and put that protocol in the medication calendar for your patient. So in many situations you already have your own protocols, you trust them, you know they are doing pretty well and you don't want to mess up with that. So in this video we're going to show you how you can save your own protocols so they are available every time you open the software and you can use them anytime you want for any particular patient. So you go for the fresh protocol, you choose the customized protocols, and once you open this you actually will find 6 available protocols that are not named. That means that you can save up to 6 protocols for your patient. And once you save them, every time you open the software, regardless of the patient that you're opening the software for, you will find these protocols available. So in this particular situation, we see the default, which means that all protocols are not named yet. So you can always click here, and then you can name whatever protocols you want. You don't have to name all of them, but the ones that you believe you're going to use. So for example, I'm going to use the first 3 protocols. I'm calling the first one the good protocol. That's not super helpful. Don't name it like this, sure. Then the second one is a better protocol. Doesn't mean anything as well. And the third one is the best protocol. Of course, that's not true. Okay, so you click here and you see that the names are shown up here. Now, what you can do is actually you decide how you want to design each of these protocols. I actually named this randomly, but you should name them in a way that makes you remember what the protocol is made for, or what type of patients you use this protocol for. So here you see the 4 major medications: GnRH agonist, antagonist, FSH injections, and HMG. So for each of these medications, you can decide what's the start day for you, what's the end day for you, and what is the dose. So let's try this just randomly, of course. So the start day would be, let's say, like 2, and then I say, okay, it's going to be till 8, dose is 0.1. I'm gonna say that's gonna be 3, that's gonna be 9, that's gonna be 0.2, and this is like day 7, day 13, and this will be 150. This is gonna be 8, and this is gonna be 16, and this is gonna be 300. So that's one of the examples. And once I choose this, that's going to be saved once I click save or just close my software. It should be fine. So I'm going to use this protocol. So if I'm going to use it right now, then I should choose it first and then click here. And remember that you can always add pre-cycle treatment and UTFA support for your protocols. That's going to show up here if you select any of these protocols. So now you're going to click here, and it's going to tell you, of course, protocol is added to the patient calendar. And then when you go to the medications, here we go. These are the medications, which each of these has a dose that you decided on underneath the injection, which appears in red as usual. So you can always use these protocols whenever you want. I'm going to show you something different here. So what if I want to start the GnRH agonist like in day 21 of the previous cycle, for example, and I want to keep using it till the 10th day, number 10 of the next cycle. So in this situation, I write the day here, 21, and this is 10. So I actually wrote the start date here and the end date here, as usual. And when I click here, what's going to happen is software is understanding that I want to start in the previous cycle. So it tells you from the day 21 and then going up to the day 10. So it understands when you write it in a reverse direction, like the bigger number is first, that means that you want to start in the previous cycle. So that shows up here as well. And again, as I show you, you can always update your protocols, and every time you change these numbers, it's going to be saved in your system. So that's absolutely okay. And similarly, you can change these numbers, so you save another protocol, change these numbers and save another protocol, and up to 6 protocols. That's totally fine for you. The only additional thing I want to say is you can click here. That's kind of help button. When you click it, it gives you some information on like general recommendations on how you can decide of how you want to like design your protocols basically. So this gives you some general information that you may find interesting to help you to decide how you want to write down these protocols. So this is for the start dose, and this is for the GnRH regimen and which one you should choose. So that's pretty it. This is how you can save your protocols for all of your patients, and whenever you want to choose one of these, just click on it and click this, so it's going to be just transferred into the patient calendar and you're ready to go.